Cortisol is a hormone which is secreted by a small gland which is located on top of the kidney, which is the adrenal gland, and it comes from there. It is a response of the body to stress, which is inside the body, not the outside stress. So if you have a problem, medical problem, your cortisol levels can either go up or down. My approach with cortisol is that I'm amazed at the number of people I've found with very high cortisol levels without even having any symptoms. Because cortisol traditionally, when it is high, it is known as Cushing's disease. It presents in a very typical way, and those patients who come to me with these could be totally missing out on that kind of a presentation. And they could be children, they could be adults, they could be older people, regardless of them. And so much so that I had to come up with a program just for the awareness. And I always do make sure that I check cortisol even with patients who are complaining of diabetes, because when patients come to me and I sometimes look at them and I tell them, I think you're diabetic, they say, no, we get our sugars checked and it's always normal, and I tell them, okay, it's because of the cortisol that it's not reported. So instead of going into Cushing's and Addison, which is the opposite, which is where the cortisol is not producing more, so that's called Addison's disease, I just divided them into hypercortisolemia and hypocortisolemia, which will be in the next video section. But hypercortisolemia is related to the condition where they're producing more than normal levels and the impact shows on the bodies. See you in the next video.